I am Dr. Allwyn Pais, consultant homeopath, professor and homeopathic physician at Yenepoya Homeopathic Medical College, Yenepoya University, Naringana, Mangalore. Your speaker for today. I sincerely hope my talk today would be informative, interesting and thought clarifying. My topic today is alopecia and its subset. Subset means the group or its offshoot or the branch which is called male pattern baldness, which is close to my heart as I have myself experienced it firsthand. Thank you very much for having me here. To start the session, firstly, alopecia is a broad terminology encompassing all types of hair loss that may include the following main headings, which are male pattern baldness, patchy hair loss. Of course, this comes into the category of autoimmune conditions where most of the medical systems, including modern medicine, are helpless to a larger extent. And last but not the least, stress-related hair loss. Today, we shall limit our discussion exclusively to male pattern baldness that is mainly seen in males. Usually, it starts with a receding hairline and the hair becomes thin, especially on the crown. Male pattern baldness is caused primarily by genetic disturbances and hormone dysfunction, specifically androgen, the male sex hormone. What you now see is a brief description or illustration of the phases of the hair growth cycle. The first, which is supposed to be the greatest and the best phase for any hair growth, is the phase called anagen. In this phase of anagen, you will see a healthy hair follicle, and most important, you will see a healthy dermal papillae or papilla. This specific term, dermal papilla, is of great importance in today's era, as most of the research is centered around or focused around this dermal papilla, which contains the stem cells of the hair growth or the preceding hair cells. If the dermal papilla is healthy, the hair grows healthy. The phase of anagen is the longest, obviously, and it depends on many factors which we shall see in the due course of our discussion. The second phase is catagen, the third phase telogen, and the last phase exogen. The second, third and the last phase results from dysfunction due to many disorders, malnutrition, genetics, environmental factors, etc. To begin the diagnosis, the correct stage or the phase of the hair growth cycle need to be understood, which we have briefed in our last slide. The four stages which we have discussed is shown as below. The first phase, anagen phase, which is called the growing phase, it lasts for the longest period, from 3 to 10 years or 8 years, average 3 to 5 years. This phase is the longest because the hair grows in this phase. The shorter the worst, the hair stops growing if this phase is curtailed down or if this phase is shortened due to various factors as mentioned earlier. The next phase is the catagen phase, where the hair goes into a transition phase. It is short and lasts only for 1 to 2 weeks. The third phase, which is the most important with respect to this disease what we are discussing, that is male pattern baldness, is the telogen phase. It is called the resting phase. It lasts for 2 to 3 months. The lesser this phase lasts, the better is the growth of the hair. Once treatment starts, or once the treatment is started, the phase or the telogen phase gets minimized, or can be completely reduced by especially by homeopathic treatment. The last phase, exogen phase, is called the shedding phase. That is where the hair sheds and lasting for 2 to 5 months. To summarize in brief regarding the phases, the anagen phase determines how long a person's hair can grow. In catagen phase, hair follicles shrink and hair grows very, very slowly. This is the start of any disease pertaining to the hair follicles and hair growth. In telogen phase, hair does not grow at all, and in exogen phase there is release of the old strands or the shedding of the hair. Now coming to the investigations part, there is a test called trichogram test, which is a microscopic examination where hair is plucked from your scalp to diagnose the proportion of hair in different phases of its cycle, that is anagen, catagen or telogen. By this test, the dermatologist or the skin specialist or a trichologist who treats diseases of the scalp can tell you how long the course of the treatment or what is the prognosis of the treatment. The anagen telogen ratio, now this part or this point is very important. In a healthy hair growth, the anagen telogen ratio is 14 to 1. That is, the telogen rate has to be the most minimum. It indicates healthy hair growth. Whereas there is a in hair fall, severe hair fall, which is called telogen effluvium. Here the anagen telogen ratio falls down to 8:1. That is, the healthy hair, which is 14 earlier, becomes 8:1. So this indicates a diseased condition where there is excessive hair loss and excessive thinning of hair. Now coming to the treatment part, as a homeopath, homeopathy is the only branch which treats male pattern baldness successfully within a span of 6 to 12 months, depending on the stage or the phase of the hair growth cycle, by permanently correcting the genetic disturbances and immune disorders following proper investigation and diagnosis. To summarize, alopecia encompasses all types of hair loss and includes male pattern baldness, patchy hair loss, especially from autoimmune conditions, and stress-related hair loss. The 4 stages of the hair growth cycle: anagen, catagen, telogen and exogen. Last but not the least, homeopathy is the only mode of treatment that treats male pattern baldness successfully within a span of 6 to 12 months. We have done that, and since I myself have suffered from this disorder, we can confidently proclaim that homeopathy does wonders to this male pattern baldness, especially affecting people of the age group. If they come for treatment below the age of 40, the treatment is much faster. After 40, it could be slightly slower, but yes, 100% successful. The references are taken from this following literatures, especially National Library of Medicine. Thank you very much.